Assalamualaikum and salam sejahtera. First of all, I would like to thank the Malaysian Medical Association and SCOMOS for organizing this virtual Doctors' Day celebration 2020. It is my great pleasure to be invited to speak to you on this historic day. As you know, 10 October is celebrated as Doctors' Day in Malaysia. The date October 10 was chosen as it represents precision 10 out of 10. This resonates with me personally, as I know that doctors always give the best in treating patients and ensuring that the health of everyone is in the best possible level. COVID-19 came to our shore in early 2020. It was an unseen threat, a new foe, nothing like we have faced before. At the time of need, we rose to the challenge. Despite facing numerous obstacles and challenges, we managed to contain COVID-19. However, the situation has changed. Recently, the number of cases have been rising at an alarming rate. New mutations of virus has been documented, and the spread of the virus has been at a scale that we never seen before. Ladies and gentlemen, we may be looking at a new surge of this devastating pandemic. Several districts in Sabah, Kedah and Selangor have become red zones, while many more green zones have become yellow zones. It is time that we step up once again. Several measures have been implemented to overcome this challenge. Administrative Targeted Enhanced Movement Control Order, TEMCO, or Conditional MCO, CMCO, have been implemented at these red zones to reduce the spread of the virus. Individuals who are returning from high-risk areas have to be screened and quarantined as per protocol. As the number of cases increase, so would be the number of staff and equipment needed as screening of the disease will definitely increase. We realize that frontliners and backliners have tough job. It is not easy wearing full PPE for hours and performing duties. Thus, we will ensure that there is sufficient human resources, sufficient equipment needed as screening of the disease will definitely increase. Doctors, nurses, and other healthcare personnel have been deployed to help ease the burden of the already overstretched frontliners and backliners. Personal protective equipment and COVID-19 test kits are being distributed to the places which need them most. We will not let our beloved staff face the challenge without adequate protection. Sadly, the increase in cases have also been down partly attributed due to a lack of attitude in regard to the standard operating procedures, SOP. Physical distancing practices, although extremely effective, seem to be non-existent in some places. Wearing face masks have been made compulsory and enforcement on this being carried out rigidly. The importance of all these are being repeated at all times. Until a definite vaccine for COVID-19 emerge, we have to continue to adhere to the guideline and take several precautions. Enforcement of SOPs will be strengthened, but I'm sure that we can follow all these measures. We believe that each individual will do their part. Before I end my speech, I would like to remind everyone to follow all SOPs, maintain physical distancing, wear masks and apply 3W, and avoid the 3Cs. As I mentioned earlier, we have to wait for the vaccines. And the only vaccine available in the world are Number one, physical distancing. Number two, we had to wear masks. And number three, sanitizer, wash your hands. Follow the official social media platform, not the unofficial one, for the latest development regarding this matter. Let's work together to flatten the curve again. As said by our DG of Health, if we can come together, we make the impossible possible. We have done that before and we are going to do it again. Thank you, doctors and all frontliners, as well as all backliners who have tirelessly worked for the betterment of the country and the world. I dedicate the Doctors' Day to all doctors in Malaysia. Terima kasih, dukung mengkudu. Terima kasih, thank you, love all of you.